I'd like to welcome everyone to the Board of Health meeting on this Monday, September 8th. It is 6:00 p.m. We'll have a roll call to begin the meeting. Stephanie Granger here, Michelle,
Here.
Joanne,
Here.
Megan,
Here.
and Stefan.
Here.
Wonderful. We're all here together this evening. That's great. And our first agenda item then is open forum. I don't know if we have anybody with anything they'd like to bring before the board.
We don't have any questions or anything at the chat this time.
Okay. Then I guess we can go forward with the next agenda item, which is to review the minutes from the August 11th meeting. And
I didn't have any comments on those.
Yeah, neither.
I wasn't present, but I read them. They were informative and I appreciated them. Okay, so no comments or changes. Is there a motion to accept the minutes as presented?
I'll make that motion.
Motion made. Is there a second?
I can second.
Megan seconds. Michelle made the motion. All in favor? I'll pass as I abstain. And Michelle?
Aye.
Joanne?
Aye.
Megan?
Aye.
And Stefan?
Aye. Yes.
Okay. That's how do you say that? 4 with Stephanie abstaining. Thank you. And thank you, Abby. So we're a little ahead of schedule. I don't know if Stephen, our new food inspector, is here to be introduced.
He is. So we're super, super excited. I mean, look at that smile on Abby's face. We're super excited about our new food inspector, and we wanted to give you an opportunity to meet him tonight. Let me just promote him. Stephen, are you there?
Yes, can you hear me?
Yep.
Welcome, Stephen.
All right, it looks like there's no picture.
We can't see you, but
All right, is that?
We're still not seeing you. Is your video turned on?
Let's see.
There you
we
are.
go. Is that working?
Yes.
Perfect. Good evening. My name is Stephen Dahlgren. I'm the new food inspector for the town of Westford. I'm very excited to be joining this town. Very excited for this role. I'm also one of the culinary arts instructors at Leicester High School in Leicester, Mass. I'd say a little bit of my background. I've dedicated the last 2 decades or so to the food industry, hospitality industry. I've worked in almost every type of food setting that you could think of. I'm also a Serve Safe instructor, proctor, and educator.
That's great. Thrilled. Welcome.
so Stephen's going to be working several days during the week at night and helping us with our weekend event. So he's in training mode right now, as you can imagine, learning software and how we do things here. How do we do inspections? So we're really excited to have him. And if you have any questions, feel free.
Is this a full-time position?
It's not. Go ahead. Sorry.
Sorry, I was about to answer. Yeah, no, part-time position, 19.75 hours a week. And like Ray said, I'll be available afternoons and evenings during the week, and then working weekends to assist with any weekend permitting and just getting out there, working the regular permitted establishments.
That's terrific. And that you're already Serve Safe instructor and such. That's great. Welcome. Anybody else have anything to say to Stephen? We're happy to have you. Thank you. And
welcome, and we're happy to have you. Very happy to have you.
Thank you. I'm very excited and happy to be here. It's been wonderful so far. It's very exciting. I love the town. I previously worked in the town of Westford, and I enjoyed my time here. The community is wonderful, and they're very supportive of the food establishments, especially the small independents. So it's very exciting for me in my role to be able to assist them and help them as well.
Great.
Can I
That's
ask a question?
yeah, please, Joan.
So, Stephen, in your academic side, do you just teach food skills, or do you teach things like food safety and public health, or is that something you might want to incorporate, and we can get some younger kids and excited about food safety and public health?
Yeah, absolutely. So currently what the way, so this is only the second year that the culinary program has existed at Leicester. And while I'm working with the culinary instructor this year, we're also building out a hospitality trade that's going to be launched next year. And so the way it's broken up, the first semester, high school students come in and it's exploratory because it's a academic high school that offers 5 trades. So every incoming freshman is required to go through all of the trades as exploratory. And in exploratory, we spend the first 3.5, 4 days teaching them about food safety. So that's a huge part of the program, even before they even select culinary as a trade. And next year, when we build out hospitality, that is going to be a huge portion of hospitality, because there are going to be students that are going to want to take that route, go into food safety, food sanitation. So it's a huge part of the curriculum now, and we intend to build it out even more.
Excellent. That's encouraging, and it sounds very different for a more traditional high school, as opposed to like a technical high school. So that's pretty cool.
It's very exciting. It's so the town of Leicester, if you're familiar with Becker College, the town of Leicester, when Becker College moved out of Leicester, the town of Leicester purchased the campus. So that's where they moved their high school to. So everything is state of the art. The kitchen is all brand new. It's all induction. It's all industry certified, what they're going to see. And we're intending to do the same for hospitality next year. The long-term goal is to build out a functioning hotel so that they can learn all aspects of the hospitality trade. And in pretty much every division of hospitality, whether it, food service or hospitality, food safety, sanitation, it's a vital part. No matter kind of what sector you venture into, it's applicable. So it's very exciting to be able to be teaching the youth that right now, and they're very engaged. It's really incredible. Even the students that aren't necessarily going to be choosing that career path, to see the engagement in them, because it's an applicable lesson. No matter what you do, where you go, safety and sanitation applies to your life.
That's really fascinating, and I like the synergy of what you're doing there and how that helps here in town too. So that's terrific.
So many of us got through school by working in restaurants and then ended up in food service. So yeah, it's great. That's exciting. Thank you.
Yeah, thank you. And welcome. And I'm sure our department is thrilled.
Thank you. Thank you.
Wonderful. Thank you for joining us this evening. And we look forward to the great things you'll be doing for us.
Thank you so much.
Okay, then I guess we're a little early on the variance request, the next agenda item. So do we want to take the
It does look like all the attendees are here for that
Okay.
item, but I don't want to, it looks like we're not until 6:20, so
maybe we should take the agent approval out of
we can
order,
certainly do, yep, sure.
which involves Stephen. So we'll do the annual Board of Health agent approval per Mass General Law, Chapter 111, Section 30.
Yep.
And do I read those off or?
You can certainly do it any way you want. You can read off the list and have them vote as a group, or the listed names that are here on the agenda as agents of the Board of Health.
Can I ask
Okay.
a question?
Yes, Joanne.
So Dan Toomey and Bob Ware, those last four, they're all guidance or
They're
right?
all deans at the
Deans.
Westford
Okay.
Academy.
Okay. It's been a while since I've had my kids.
No, that's okay. We do vote them in each year.
I only recognized one name.
Okay, so we just read them off and then vote to accept them as agents.
Yeah, you can probably read them as a group and then
Okay.
do one vote, and unless, of course, you want to do them individually, that's up to you.
Okay, I think we can probably do them as a group. So, let's see. So the motion is to accept Stephen Dahlgren as a food inspector, Detective Anthony Bernardin as a primary at WA, Officer Nicholas Mariano as an alternate at WA, Detective Robert Musto as primary at Neshoba Tech, is that NT? Officer David Silton, alternate at NT. Again, that's Neshoba Tech, Ray? Okay. Dan Toomey for WA, Bob Ware, WA, Betsy Murphy for WA, and Amanda Welch for WA. I'll just go ahead and make the motion to accept those as read as health agents for Mass General Law, Chapter 111, Section 30. Is there a second?
I'll second that motion.
Okay, motion made and seconded. All in favor, Stephanie Granger, aye. Michelle,
Aye.
Joanne,
Aye.
Megan,
Aye.
and Stefan.
Aye.
Great, that passes unanimously, and thank you to them for their role, such as it is. Okay, we're still a few minutes early.
Can I ask a question then about that? Like, and you might have said it right, but like, why do we, as the Board of Health, why do we vote for the deans for the high school?
Sure.
Just
Sure. So what happens is if any employee for the town or for the school is going to be enforcing a regulation, or in this case, a mass general law. So for instance, you voted last month for 3 employees that work in the town clerk's office that oversee our death certificates here in the community, our death and birth certificates, in which case that is something that the Board of Health is responsible for. In this case, we need to make sure that we vote in our new food inspector so he's able to do food inspections here in the community. And then the rest are actually to enforce our tobacco
okay.
regulation.
There's
So
the
most of these
basic
folks write
tobacco
tickets.
things that we talked about before, since they're the deans and they enforce that. That's what, okay, that makes sense.
So our school resource officers and deans are writing tickets, unfortunately, for tobacco and vaping.
Yep. Cool.
Sorry, we should have clarified that before the vote, but thank you, Ray, and thank you, Stephen, for clarifying that. Okay. Still have a few minutes. I'm trying to see what we could fit in.
Maybe the COVID vaccine availability?
Yeah, do you think that's short enough there, Ray, to give us the update on COVID vaccine availability?
Sure. So I just
A
wanted.
couple minutes of things, so just to give you the heads up with that.
Oh, okay.
After you talk, so
Okay.
you can do it in 3 minutes. I can do it in under 2 minutes.
Okay, so I just wanted to make this board aware. At the time when this was being put on the agenda, every day it's changing. Walgreens and CVS here in Westford were not going to be able to offer COVID vaccine, which has since changed. If anyone has seen the news, Governor Healy's office did just announce immediate steps to ensure vaccine availability here in Massachusetts, which we are very excited to see. We want to make sure that everyone has an equitable opportunity to health equity to be able to have access to vaccines, not just COVID and RSV and flu, but all vaccines here in the Commonwealth. So we did put out through our social media campaigns that we do encourage all residents to just double check with their healthcare provider for access to any vaccine that they're looking for, whether that's flu or COVID. Here at the health department, we do have flu clinics that are posted. You can see those on our not only a social media Facebook page, but our web page. And you can actively sign up for those now. We do have a wait list for COVID-19 vaccines. So you can certainly call the health department and we'd be happy to put you on a list for COVID. The other thing is we're just letting residents know to just pre-check with your health insurance. Governor Healy's announcement is covering Massachusetts issued only insurance carriers. So if you have someone who lives lives in Massachusetts, but might have an out of state insurance, you just want to pre-check and make sure that they're going to cover those vaccines that you're looking to get for, especially when it comes to COVID. And I think that is it, unless you have any questions for me, because I know Dr. Gopal wants to say a few things. But we certainly do encourage the COVID-19 and the flu vaccine. I know we're kind of pressed for time, so I was going to pull up the COVID dashboard, but if there are any residents that are wondering what's happening with the numbers here in the community, in the state, as far as COVID-19 confirmed cases, there is an influx of of positive cases here since July. But you can see those graphs and you can see the latest data as well as wastewater. Oh, Megan.
Yeah,
I think that
Megan.
would be great if you did go ahead and plan on
Yeah,
showing.
take a
Sure.
moment, Ray.
Yeah.
Sure.
And just what Ray was saying again on Maura Healy making it a Massachusetts requirement for health plans to cover vaccinations that are recommended by the Massachusetts Department of Public Health. A lot of us have an insurance plan that might be Blue Cross Blue Shield, but it might be from Illinois. And so that may be a question, or if it's United Healthcare or Aetna, they may be based outside of the state rather than issued in the state. And so that's why calling your insurance can be important still moving forward. Do you have those then, Ray? Yeah.
Yep. Do you see that?
Yep.
Yes.
Okay, great. So this is the COVID-19 reporting page. Just to quickly bring to your attention, there is a separate one where you can follow COVID-19 and wastewater in several areas of the state, but this one is particular to case and death rates. You'll see there's been no reportable deaths from COVID-19 since July 5th. However, to the left, you will see total cases, again, which can be difficult to explain because most folks, if they are testing for COVID now, they're tested. They can certainly test at home, and those reports are not sent to the Department of Public Health. So these cases are for ER visits. They do not contain any testing that is done at community health centers, and it also doesn't contain urgent care centers. But you can see that there's been an increase in numbers since the beginning of July. So, it certainly too, as more kids go to school and, kids are back in daycare, that kind of thing, just something to be mindful of.
Right. I think, Ray, what you're pointing out there is really critical, that gives us a trend. We can see that it's increasing. That's certainly, the numbers are not representative of how many cases are out there. Wastewater might almost give a better example of that to a certain degree, but really it's still just trend that it's increasing right now.
Can I use that as a jumping off point?
Sure,
And
thank you.
super brief. But can I ask, in those graphs that you were showing, Ray, can you drill down into that at all and see stuff by age if you were to go on there? Or is it just total aggregate?
Yes, you can. Yep. Let me bring it
Okay.
up.
I was just curious because I just will speak to and then be quick, like because I was looking at data that I wanted to bring to people's attention, that is nationwide data, and it is the percentage of emergency department visits for people that are diagnosed with COVID-19, and as would what would not surprise people, the highest age category that is seen in the ED due to COVID-19 over the course of the last 6 months is those over 75. But what the CDC data has shown, starting in July, and if you're looking at August, which I find incredibly interesting and want to make people aware of, that currently the highest age category that is being seen in the ED is children 8 to 11, and that's almost fourfold greater than those over 75, which is still in second place. But the third and fourth most common people that are being seen in the ED after 75-year-olds is 12 to 15-year-olds and then 16 to 17-year-olds. So besides the over 75, it is children that are being seen in the ED. And in taking less than 1 minute, I just want to go on record and say that I think RFK Jr. is a horrible person to be in the position that he's in. He's completely unqualified, he's dangerous, and his policies are going to lead to deaths. Back at the beginning of the pandemic, they looked at data and found that there were 12 people in the country that were responsible for 65% of the disinformation and lies that were being told about COVID and vaccinations. And he is one of those people that was doing that. Like, to turn to a positive note and end on this very, very quickly, I do want to thank people like the West Coast Health Alliance, which is California, Washington, and Oregon and Hawaii, that are stepping up and superseding the CDC to make vaccine recommendations in their areas that are based on science. I want to thank the Northeast Coast Coalition, which is our version of states that are stepping up and doing this and making science-based vaccinations. I want to thank Governor Healy, who has implemented these insurance coverages that Ray was talking about. I want to thank the public health commissioner, Dr. Robbie Goldstein, who we didn't talk about it, but he has made available like a blanket standing order for vaccinations so that people are able to get them in Massachusetts. And I want to thank the Westford health director, Ray Dick, for everything that she's doing, like in these confusing times. Like, I'm seeing her chasing down this information. And I am so happy that there are people working positively against these negative forces out there. What I want to end on, which is actually interesting, and I don't know who would pick this up, whether this is us in Westford, because it does fall in Westford, but I actually did go by Walgreens today to kind of ask them as a physician what was available. And they said that currently they would only give vaccinations to people based on pharmacy recommendations for those over 65 or those that have a high risk factor. So that doesn't appear that the pharmacies are making it available. That being said, when I asked him what was needed for people to verify that, they currently don't need like their doctor writing a prescription or anything. He said as long as they're just checking off when they're signing in that they have that. But again, it does seem to be that there is that discrepancy. And so I don't know who it would be, because it seems like they should be like these things that have moved forward seemed like it was going to be that the pharmacies would make that available to anyone that wanted it. And so it doesn't seem that that has hit the ground here in Westford. So Ray, I don't know, like, I mean, it may just take a little bit of time, but if I were to continue to see that pattern, who sort of addresses that? Do you know, or can you?
Yeah, so myself and our public health nurse have spoken to the pharmacies here in the community, actually every day this week. And so as information is changing, I know that one pharmacy did mention that they are waiting for, the corporation to make a decision. So they're both big corporations, and they're trying to weave through it, the insurance piece of it. But they both have the vaccine on hand, and they were waiting for the standing order, which they did receive. But we're waiting to see if there are limitations to them offering the vaccine. And at this time, there are some, as you mentioned. So again, our information is check with your provider, check with them ahead before you show up for your appointment, make sure you're eligible, and also check with your insurance carrier to make sure they're going to cover it. The last thing I want to see is any resident get a bill in the mail, and have misinformation.
Yep. Awesome.
Thank
Thank you
you.
so much.
Thank you, Stefan, and thank you, Ray.
Thank you for bringing that up, because it is confusing between whether the insurance covers it and whether the facility offers it. And, it shouldn't be. And
No,
I agree with everything you said, Stefan.
And I think that, I really also want to reiterate that we were thrilled with the vaccine rates here in town for children entering school. And I hope that people will continue to work with their pediatricians and to get their children vaccinated like they have been here. It protects all of us. And with that, I think we should go ahead and move now to the variance request from the Westford Board of Health well regulations for the barn at 35 Tadmuck Road to be serviced by the existing well on the adjacent lot at 31 Tadmuck Road. Kirk C. Fitzpatrick Civil Solutions Incorporated here.
Okay.
Get those people on.
Sure. Let me promote Kurt and promote. Kurt, you there? Abby, do you want to give a brief
Can you hear me?
description?
Yes, we
Okay.
can. And if it's possible for you both to turn on your
Yep, there we go.
cameras, we'd appreciate that.
So
And
I'm Kirk Fitzpatrick. Oops, excuse me.
Oh, sorry. Go ahead. Welcome. And Ray, I think Ray had just asked Abby if she wanted to give us an overview.
Sure.
Yep, I'm sure Kirk can speak to this after too. So there is a request to use a well from the property at 31 Tadmuck Road, 435 Tadmuck, which is a kind of like apple storage barn at the Drew Farms apple orchard. And they want to put a bathroom in and have the toilet and water be serviced by the well at the dwelling at 31 Tadmuck Road. So the variance is for a shared well, because our local well regulations say that every property has to have their own water supply. I don't know if Kirk, you want to go from there?
Sure. So I'm Kirk Fitzpatrick with Civil Solutions, and I'm here on behalf of Keith Boney for his properties at 31 and 35 Tadmuck. So Keith owns both properties. He lives in the house that's kind of surrounded by number 35. And the design plan in front of you is for the proposed septic system to service the barn. So the barn is going to be used for the storage of apples and the sale of apples, but it's going to be seasonal use. They looked at connecting into the town water, which is in Tadmuck Road, but the cost they thought would be excessive. I talked to Bob Johnson, who's the contractor doing all the work on the site, and he thought that the average cost of connecting that into town water there would be 20 to 25,000. The water line's on the other side of Tadmuck Road from the barn, and the material there, the existing material on site, it is a sand and gravel, but it does have a lot of large stones in it, which I think they would find, and it seemed to get worse as you got towards the barn, which is one of the reasons why we tested over to the left of the barn. But when they dug the footings for the barn, they encountered an extremely amount of large stones, which would drive up the cost of the water installation. So what they're proposing to do is to connect the barn to the well on the adjacent property number 31. They did have the well tested, and it came back clean, except it did have some uranium, and the sodium was higher than what the state would like.
Thank you.
Yes. Sure.
Abby and Ray, did you have any comments that you wanted to share with us on your thoughts about this?
So to just, Abby, feel free to chime in. So typically with our local well regulations, you two parcels would not be able to use the same well, and that's the reason they're here for tonight. However, in this situation, the owner has two parcels, wants to use the private drinking water well, am I correct, Kurt? And use that into the barn for the bathroom facilities only. They have pre-packed cider donuts and pre-packed cider. And so there's no, for instance, 3-bay sink or hand sink. It's going to be for the bathroom use only. Our recommendation tonight is that they post that the water's not potable in the bathrooms. Or have the water remediated for the uranium. We're concerned about employees filling up a water jug, possibly drinking the water. I know that the owner did mention that he offers bottled water for all employees on the property. We were also concerned that when and if one of the parcels should be sold in the future, what will happen. And so in your packets, you'll see that I believe, Kurt, was that your office that put together the declaration, the agreement for sale?
No, it wasn't. Keith, that's Keith's attorney that put that together for him.
Okay, thank you. And forgive me if anything I'm saying is incorrect. Abby, anything I'm missing? We're okay as long as they either post.
Yeah, I think
ask
that's
for uranium.
fine. I did want to add that our DEP sources for remediation of uranium does suggest a point of use, reverse osmosis treatment. But in the point of use, so that is just treating like for a sink, for example, for drinking water. And at that level, DEP says that the water coming out of a faucet would be safe for bathing or doing dishes. Let's say like washing your hands would be acceptable. So, the board could either decide to ask for remediation to play it on the safe side, or to, again, like Ray said, post it as, hand washing water, no, not for drinking at the sink. I think either would be acceptable.
Okay.
And I also wanted to add that we will also have them sign a well declaration, which goes on their deed that, so for instance, we use it a lot of times for new construction, for a new home. It's a deed restriction that just flags whoever does own the parcel down the line that this is in the well water. So we're gonna have them do that as well. And we'll also going to put in writing that they will be limited to these particular pre-packed foods. If they decide to expand in the future, they want to make apple pies, right? They'll need to put in a sink, they'll need to remediate the water to be able to prepare foods for it.
Can I ask a slightly tangential question?
Sure, Stefan.
So if we're talking about that, where this is going to be sharing from this current well that has the high levels of uranium in it to a spot where you would either want it remediated or to be posted as not potable, what does that mean to, like, who's currently drawing off the current well? Like,
So-
Existing house.
Yeah, the existing house, and my understanding is that because they currently live there, it's their choice on if they were to sell, it would have to be remediated. Yes.
Yes, so it's a family farm. And so the house is on one parcel and next door is the barn with the apple orchard.
So, but the recommendation would probably be that the family remediate their own water for their own uses, but
Right,
that's
it's not required.
not required.
I have a question. So sorry. So
Yep.
customers are not using the bathroom, it's for employees? Or,
That's my
Or both.
understanding. The bathroom is to be used for employees only.
and then where do most of their employees come from? Is that going to be something that can be read and understood and like,
Linguistically.
are they international employees or do they usually do all their farm, like, or are their employees doing their harvesting locally? Does that make sense?
I think they're longtime employees that are familiar with the farm. I don't think he's got a big turnover of employment, so I think they understand the parameters
Right.
of
No, I'm
of the
just
barn,
thinking
use
like
of the
there's other
barn.
local apple farms that have people that come in from like other countries and do their harvesting. So if that was the situation and you had a sign there, it wouldn't really mean anything.
In other words, the language you're talking about, to have the signage and the language in which any worker could understand.
Am I muted?
There we go.
No, there you are, Keith. Thank you. Did you have a comment on that?
No, we don't use any international labor. We don't use any Jamaicans. All of our labor is local, usually from Westford, some from Lowell, but they're obviously we have some new employees on occasion because we hire younger people and hope to have them employed for 2 or 3 years, and then they're off to college, so we need other people. But they're all local people.
Okay, thank you.
Yep.
Any other comments from board members?
I have comment,
Okay,
comments
Joanne?
and questions.
Comments and questions, yes.
I have a bunch.
Okay.
So I saw that you did water testing, but did you do any pressure testing to make sure you have enough volume for another building or use?
I don't think they did any pressure testing. I think it's gonna be minimal use as again, it's gonna be seasonal use. And it's really just to service the one bathroom in the barn. It is a drilled artesian well. Maybe
Personally,
Keith knows more about the well
I'd
than
like
I
to see
do.
a pressure test just
So
to,
over the years, we have been using that water to water chrysanthemums when it's in season. We water at sometimes we're watering 400 or 500 pots of chrysanthemums, and we do not run out of water. I use that water at that point to fill my sprayer to spray the orchard. I can fill the sprayer of 300 gallons without running out of water. The average rate of flow, depending on whatever, is 4 to 5 gallons a minute. In other words, I have a 300-gallon tank, and I time that because I don't want it to overflow, and it takes anywhere from 45 minutes to an hour to fill the tank. So that's 4 to 5 gallons a minute, and I do not empty the well at that point. So pressure, well, I suppose volume, we've got plenty.
Okay.
okay.
Can we flush a toilet? Yes, we can.
Okay, but
That would
that's
be
not anywhere in writing where we can verify any of what you just said. That's why we would have it professionally done to be sure. But my issue now, since you're saying you're spraying the orchard and using a well that has a uranium and sodium issue on your orchard and on your flowers, I would have a real concern with not having a remediation on that well. We can't guarantee that no one's going to go into the bathroom. I'm assuming it's a single bathroom. Am I wrong there?
It's a single.
Yeah. You still are not going to be able to absolutely be sure that some kid isn't going to go in or some other employee isn't going to go in and fill their water bottle with water that we know does not meet standards. So I'm not comfortable with saying it's okay with issues that are known with the water. I'm going on record as that. So seasonal, what are the dates? How many weeks or months out of the year
For what?
that this will be in use, the barn and the water?
We generally open the first weekend after Labor Day, and we will be closing before Thanksgiving.
Do you not open at all in the summer?
That's correct.
Okay, so it's, I don't even know how many weeks that is. Okay. And then you said that the barn is going to be used just for the sale and storage of apples, but now I'm hearing about apple cider donuts and other things. So what is the barn used for? Or going to be used for?
So what we have been doing for the last 20 years or so, although that probably doesn't make any difference, we open up and we have pick your own apples. We sell apples that we pick ourselves for roadside sales. We sell cider that we purchase from an outside vendor, Carlson Orchards. We sell apple cider donuts that we purchase from an outside vendor, Honey Pot Hill Orchards. We sell pumpkins. We sell chrysanthemums.
Okay, so it's not just apples. All right. I'm trying to just look at my notes. Okay. I guess that's it for now, because they did say there would be a declaration that would be added to the deed, so that's good. Thank you.
Okay, thanks, Joanne. Any other board members with questions or comments? If you have, speak up. I can't see everybody in the current screen configuration at once. Okay, Ray and Abby, did you have any last minute thoughts, or did Mr. Fitzpatrick want to say anything else?
No, the only thing I was going to add is that declaration does say if the properties were ever separated, that the orchard would not be able to use that well for a water supply.
Okay.
I don't at this time, unless you have questions for us.
I guess my only question would be, I mean, I looked at the report, but I'm not an expert on the levels and things and, you know, how significant the uranium levels were. It sounded like you said it was okay for bathing and such, according to DPH standards.
Yep, that's correct. Yeah, according to Mass DEP guidance and standards, they suggested remediation for drinking water. However, uranium isn't readily absorbed into your skin. So bathing theoretically would be, okay, or much less risky. I mean, of course, there is still uranium. But I think the safest of the options is to have remediation. However, it would be more costly. So if the board decides to go with suggesting, posting at the sink, I think we obviously would inspect and ensure that the posting is at the sink, saying not potable water. And we would just go from there. And like Ray said, according to Keith, bottled water would be provided for staff.
But didn't Joanne bring up, it sounded like the water is used on apples sometimes that then I'm assuming are being eaten, right?
Yeah, I'm being honest. I'm not going to agree to this unless there's remediation on the well. I mean, you can post a sign all you want. Doesn't matter. People are still going to drink it. The door's going to be shut. They're going to fill the water bottle. There's nothing you're going to be able to do about that. And I'm not comfortable saying it's okay,
I did just spend my whole summer not drinking water because it wasn't potable.
People don't know what that means.
Okay, not. We can water not for
Not for drinking, but
I could be incorrect, but I believe that if you have a water test that shows uranium in it, that the actual risk factor is that it's off-gassing radon gas. So it's really an inhalation hazard. It's not a drinking hazard. So if you're taking an hour-long shower and your well water happens to have uranium in it, then you are breathing radon gas when you're in the shower.
So it's less of a contact thing and more of a,
Exactly. It's not a contact thing. It's a length of exposure, and that's where you would use probably a point of use filter on your shower head or on your kitchen tab. But it's not going to be a hazard, to my knowledge anyway, to have contact with the water.
okay, thanks, Michelle. Appreciate that. Um, so I think we know where Joanne stands.
Well, and the pressure testing too. It just,
pressure testing.
it's just a test to make sure that there's enough.
I mean,
water.
I hear what you're saying on that, but I think it's a toilet and a sink. So for me personally, that isn't too big of a concern, but Megan.
So yeah, it does seem like you could do something else. Like if you didn't want to do the remediation as far as providing a bathroom for your employees. And I mean, maybe I'm naive. I don't know the costs of things, but if it's just for a couple months, can't you do a porta potty, or is there some way to do a sink that is like, again, this is not my area of expertise, but like when you go to a sink and you live in Massachusetts, you do assume you can drink it. It's like, but if you are on a farm where you pump it and it comes through the little, you guys have seen the sinks, right? Where you have to like pump it with your foot and like, I mean, is there some way to do it so that it's clear you can't drink it?
For the hand washing.
Sorry, it just seems like it is a bit of a risk when you could probably do something else for your employees, but.
I guess a question then would be for Ray and Abby, how big a concern is the drinking?
I'm sorry, can you say that again? How big of a risk? What?
Is there from drinking water with a uranium content in it?
Again, I agree with what Michelle said. It's an off-gassing with uranium and radon. I'm not an expert in uranium or, what does long-term look like for cancer exposure. Um, I don't know what the cost is to have just the sink remediated for uranium. I don't know if Kurt or Keith has that information, but I don't know. Is it possible someone could fill up their water jug in the sink? Yes. Are there other options? As Megan mentioned, yes.
So yeah, did you guys look at the cost of doing a POS on the
I have
sink?
not. I have not. I've had one installed at a house before, and it was not overly expensive. So I think if the board leans that way, I don't want to speak for Keith. I wouldn't mind if he chimes in here, but I don't think the point of source filtration is out of the question. But I guess I'd like to hear Keith's opinion on that.
Is also, and also the sodium.
Correct. It would treat both. So
I don't think that the cost of point of source treatment is a burden.
Okay.
I think that's something we could do, a point of source remediation.
Sounds like perhaps okay, then maybe, is there anybody who would like to make a motion to accept the variance for the well, but with a change requesting the point of source?
Can we, before you make the motion,
Yep.
can we, discuss a little bit more about the pressure testing, or is everybody not concerned?
Ray and Abby, what are your thoughts on that? Ray?
I agree. I think it's a good idea. Especially with climate change, we're seeing more and more people with wells they've had for 50 years that are running dry and, that it never had a problem before. And I would just hate to see that happen to him. So it'd be nice to know ahead. I mean, I know he mentioned the calculation with the 4 to 5, but if it makes this board more comfortable and to make sure that there's enough supply for both the home and the business, especially that his daughter had mentioned that they want the business to grow and we want them to succeed, and we're here to help them with the options they want to add in the future. So I think it's a good idea to add that. I would just say that as part of the vote, whatever that might be, that we make sure that the declaration, the 2 declarations, is the one that his attorney wrote, and this a 1-page that the health department writes up.
That we want to include those.
Correct. And that will specifically mention the sodium and uranium in those levels.
Okay. How do other board members feel? I mean, do we want our people, seems like there's a leaning towards requiring the point of service remediation. And then would we like to request or to also, if we're going to approve this, sorry, I just lost my paper here. Also, I guess we can vote. I don't know. Does anybody want to make an attempt at this variance request?
Do you want me to try? Okay.
Sure, Joanne.
All right. I'm going to make a motion to approve the variance request from the Westford Board of Health well regulations for the barn at 35 Tadmick Road to be serviced by the existing well on the adjacent lot at 31 Tadmick Road, with the conditions of a point of source remediation in the barn, pressure testing to be completed indicating adequate pressure for both the home and the new facility, and that both declarations, one from the Board of Health and one from the attorney, be added to the deed officially.
I second that motion.
Okay, motion made and seconded. No other comments?
Actually, I just had one quick question. So the point of source remediation, that would be for the sink only.
For the
is that
sink only.
correct?
Yeah,
Okay.
could we make that clear, I guess?
As a point of order,
Yeah,
Madam Chair,
it shouldn't come from.
no, I just thought of something else.
Oh.
Just to be clear,
Okay,
there is only going to be one sink, and that one sink is going to be in the bathroom.
yeah, I think that's already
Is that
spelled.
true?
Yes, that was spelled out, right, Ray?
Okay.
That's my understanding.
So
Right.
there wouldn't be a sink to wash the apples as they're coming off the trees or anything.
So we would
No,
make,
it's a sink for the bathroom.
and the point of service on the sink in the bathroom.
Apples are being washed with water from somewhere else, it sounds like.
Ray,
Are they?
Ray, you had a comment?
Yes,
Didn't he say that?
oh, sorry.
No, go ahead, Ray.
I just wanted to add that we will also provide a letter of whatever this decision is that the board makes this evening on the variance request, and we will certainly put that in, that it will be sink only, because again, we do want to make sure that we add language that if they do add any additional food products or drinks in the future, they'll need to reach out to the Board of Health.
Okay, great. Okay, do we think that then is ready for a vote?
But may I get clarification on the fact that the apples aren't being washed with any of this water anywhere else?
I mean, that's not really before us for this.
Is your question, are they,
At the
do they have
barn?
other sinks that they want?
Okay, so I guess you have a point there, because this is just for the single sink at the barn,
Mhm.
and then I'll raise my concern after.
Okay. All right, so a motion was made and seconded, and all in favor, Stephanie, yes, Michelle,
Yes.
Joanne,
Yes.
Megan,
Yes.
and Stefan.
Yes.
Okay, so that passes unanimously. Don't want to hold the farm back. I love Drew Farm, but want to make sure that everybody's health and safety are considered. And I guess, Joanne, you still had a question
I
you
just
wanted
want
to
to,
pose.
I'm just questioning, are the apples washed using this water in another location?
No,
Okay,
There we go. Thank you.
thank you.
All right. So hopefully that is, will work out well and can be done quickly. Getting the testing and then getting a point of service for point of service filtration for that sink, just to make sure people are safe.
Great. Thank you.
very good.
Thank you very much for coming.
Thank
You're
you.
welcome.
Okay. We took the health agent approvals out of order, so now we are at the discussion on the act to promote economic opportunities for cottage food entrepreneurs. What is your update for us on that, Ray?
All right, so at the last meeting, the board discussed the cannabis and cottage foods bills, the proposed bills, here in Massachusetts. I was asked to reach out to Cheryl Sabara at the Massachusetts Association of Health Boards regarding both of these bills, and if they were filing anything on behalf of boards of health and health department associations, mass associations that would be advocating for both health departments and boards of health. And so there were 3 documents in your packet. One is from the Coalition of Public Health, which contains 6 associations, and any from Massachusetts Health Office Association, Environmental Health Association, the Nursing Association for the state, and also Western Mass Public Health Association and the American Public Health Association. So that's one letter, and you can see there were 2 others, one from MAHB on behalf of boards of health. And so there was a discussion at the last meeting if this board wanted to put something forward, or again, make a decision after seeing what has already been sent out on behalf of public health and for Massachusetts.
Yeah, those they were good letters, I thought, with bringing up some very good points. Did anybody have any comments on that? Your silence, Joanne.
Oh, maybe this is, no, that's this. I think I'm missing a letter, that's all.
There was the CLPH. Oh, that was
Yeah, that's the one I think I'm,
the MHB.
I'm working off of 2 computers.
I know.
That's okay. So the
Sorry.
one from the Coalition of Public Health is for cannabis only.
Right.
Right.
Because MAHB had already sent one on behalf of boards of health and health departments regarding the cottage foods, and they were at all the public hearings for both.
So
Oh, okay.
is there any point at this to us still sending a letter? Or, I mean, basically it sounds like the other one of the health boards just basically sent the same letter as MAHB.
Correct. So it's really up to you all. Sometimes I mean, I think it's covered. I really do. But again, I don't want to discourage the board from, I hear and from nursing school, I hear if it wasn't documented, it never happened. So, so it's one of those things. I don't want to persuade the board either way. It's really up to you. But as you can see, I just wanted you to let you know that quite a bit has gone out and testimony has gone out on your behalf for boards, I should say, across the state, boards of health.
How do
Ray,
Go
do you
ahead.
have any idea when, not the cannabis, but for the cottage food, when that's going to be heard or brought back up?
It is not at this time. I keep checking, especially where they're now in session. But as soon as I know, I'll let you know. There's a lot of different bills we're following, but this is one of them, and I usually try to check in weekly. But at this time, it's still at the Department of Agricultural Joint Committee.
Thank you.
So anybody have any opinions about whether we want to just allow the MHB to be speaking on our behalf, or if we feel like we should send our own version of a letter?
I thought all the letters were really comprehensive.
Yeah, I did too. I thought they were excellent.
Yeah, I think that's great for now.
Okay.
I mean, unless, you know, it depends on how it moves forward on the cottage. We kind of, the cannabis stuff is a little further on.
Uh-huh.
So maybe later if they need some more voices, but I think, yeah, it's good now.
Anybody else have a different opinion or? Okay. Then thank you for sharing that. Those are both, I mean, pretty substantial bills with some significant issues within them for health departments around the state. So it's a concern, I would say. So thanks for bringing that to our attention and sharing that.
Sure.
We talked about COVID-19 vaccine availability and hope that clarification will continue to proceed, and that hopefully our local pharmacies will be able to provide that to a larger population. And then now we have old and new business, right?
Sure. So just an update on West Nile virus here in the state as well as for Westford. There are 28 mass communities that are at high risk right now for West Nile. Um, yeah, if you haven't seen the news, there are 4 positive human cases, and I will say that those ages range right now from 40 into the mid 80s. So there's a wide range of folks. I think a lot of times people think, oh, you know, this might be something that affects maybe an adult, but that's not the case. We've seen children in the past. We've seen young adults, middle age, and older. So it really doesn't discriminate. So I just want the public to be aware of that.
Put a plug out for like the picaridin based.
Correct. So yes. So I was
And
just
that one far less offensive personally, but it seems to work quite well. The DEET ones I have a hard time with, but
yeah, I know there are some lemon eucalyptus sprays you can get now with DEET in them. I know it's hard. I understand. Um, But we have put out lots of education again on our web pages, social media. We do talk to residents. I did want to just bring up, if I could, real quickly. There is a dashboard, another dashboard for folks can follow mosquito-borne illness throughout the state. Westford is moderate. Let me just bring that up quickly if I can.
Just while Ray's looking for that, I just wanted to let everyone know that we do have a page now on our website, which has all the resources and a link to the state maps which are updated. So if people are interested, they can find it under the mosquito-borne illness section on the Westford Health Department page.
terrific. Thanks, Abby.
Thank you, Abby. Yeah, it's not coming up at the moment, but you can bring up mosquito-borne illness for the Massachusetts Department of Public Health and put that in your Google search. They do also have a dashboard similar to COVID. You can see in real time not only the human cases, positive mosquito samples. You can break it down right down to your town, and you can see what the plan is going from low, medium, moderate, and to high risk. So I just wanted to let the public be aware of that. And yeah, unless you have any questions, you know, we're certainly watching it every day. We look at all of our mosquito samples here through the Central Mass Mosquito Program, and we try to put out the information as soon as we receive that by alert.
Thank
Um,
you. Ray.
Right.
Stefan?
Like, so I think this is great. We do this. I think it's disappointing that like zoonotic diseases are like expanding and stuff like that. I just, if I'm wrong about this, I'd like it corrected. And I think that I read it correctly. And then it's just unfortunate that this great resource seems to have timed out. But we had the Central Massachusetts Mosquito Control Project people come on and tell us about the resources they do and how, while we can continue to use them to spray for like town stuff, I believe they no longer do the private spraying. I think they ended taking requests for that at the end of last month. So unfortunately, as these pop up, like you can't get them to come out and just spray for you anymore. So if I'm wrong, I would love to be told that, but unfortunately, I think it's that's where they end the season kind of thing. So
You are correct. I will say that they do still spray here in the community. Every month they send us dates that they are spraying. There's generally 6 dates for the month, and that is something that we do also post not only on our town board here at the festival at the town hall. I know, we're required to post it there. We post it at our health board, and then, like I said, our social media website. We update that information of when they'll be in town. But yes, you are correct. If you wanted to have a private vendor come out to your home, you could certainly do that at your own cost.
Thank you.
And I should just add that aerial spraying is not something that our department would be considering unless the community had a positive case here in Westford. We get these questions a lot, so that's why I mention it. A positive case here in Westford, or we were considered to be a high risk community.
Thank you.
Hmm.
And then, as we head into the fall, we've got West Nile, and then we're watching for Triple E, which frequently becomes a concern as we head into the fall. Though it's been a pretty dry summer, I've heard. So maybe this year we will hopefully escape. Okay, the employee wellness update.
Sure. So I just wanted to make you aware that we do have a virtual cooking and yoga class this month for employees. We are giving out yoga mats to the first 25 employees that would like one. And we have, I think it's 25 cookbooks we've ordered for not only the American Heart Association cookbook, they come out with one every year, but blue zones across living to be a sanitarian. So there's some incredible cookbooks as well. So we have that going on for employees. September Suicide Awareness Month. So here, the health department with grant funds are purchasing a teal polo shirt for anyone, any town employee that would like to wear one for the month of September on Friday. We're all wearing our teal shirts. We have pins, little bracelets. And so each year we take a picture with WestfordCAT, and we'll be doing that again this year. So we're really thankful to all of our town departments that are working together to wear those shirts. And we work closely with See a New Sun, which is SANS. They're the folks that have the posters, and that we've purchased all the 988 and the suicide awareness flags that you see at the Common right now for the month of September. So just trying to get education out to let people know it's okay to be okay, and it's okay not to be okay. And so if anyone needs any kind of assistance here, they can reach not only the health department, your school nurse, counselor. We have the community wellness coordinator here in the community. So here, if anyone needs any help or assistance, and we encourage, you can text privately, and you can also call 988.
Thanks, Ray.
Yep. The rabies clinic. So this is new for our department, not, because we don't have enough going on, right? So, we're working with our animal control department to host our very first rabies clinic for cats and dogs, and that's on September 20th from 9 a.m. to 11 here at the Abbott School in the parking lot. We're working with RAM Mobile Veterinary Care out of Pepperell. Many other health departments have used this vendor, this veterinarian, to provide the rabies vaccine, which is really a win-win for all of us. As you're probably aware, we do review the rabies reports that come to our office and any bites. We do educate families on rabies exposure throughout the year. So this will be a great thing. Just want to bring that. It's $20 per pet. You don't even have to get out of your car. They come to your car. You fill out your certificate. They bring Fido and Fifi into the mobile clinic that's on site, give them the vaccine, and return the animal back to you. So we're really excited to be offering this for residents.
Great.
What pets does that cover? Is that just like cats and dogs, or what is that?
Just cats and dogs. The first year, we can't have the reptiles and the everything else is, you know. No, yeah, cats and dogs only.
Sounds great.
Okay, so update on 37 Powers Road. Just quickly, this is just to refresh, this is the I believe it's 512 units going over on 37 Powers. So the plan has not been submitted yet for the wastewater treatment facility to DEP. The contractor for Hancock, who was overseeing the project, has let us know that it will be probably a few more months before that is submitted. And then it certainly takes time for DEP to review everything and approve. They're working on a plan for the pool discharge. So they are going to have a pool on site, and we always, Abby works closely with all the designers and installers, but anyone that's has a pool at any of the condominium sites that are on a treatment facility or private septic for that matter need to have a way to discharge the chlorine before it's discharged to the groundwater leach fields. So that's something that we check on. And then we're working with them on things like their irrigation wells. At this time, they don't believe there's any current wells in the property that need to be abandoned, which we're working with them. And we are working with them on dumpster sites and making sure that there's no future issues.
And I saw the water thing.
Yes, that was, yes,
Approved for.
they were approved through the hydraulic study.
Okay, thank you for that.
Yep. Okay, so just a couple things, events. Health Day at the Council of Aging is being put on by our public health nurse on September 9th. She's CPR, choking, glucose, checking cholesterol, blood pressures. So that looks like a packed day over there. Gail's providing that.
That's
She's
at Cameron Senior Center.
It is, yes, it is at the Cameron Senior Center. Sorry, they have COA. It's always mixed, Council of Aging. And we have flu clinics are coming up to, again, just to remind residents to sign up for your flu vaccine. We have our senior clinic. We have 2 evening clinics from 4 to 8 on October 16th and 23rd for the general public, ages 3 and over. We this year we've added the Housing Authority. We're going to them to provide any assistance to give them their flu vaccine. If anyone's homebound and needs a home visit, please reach out to the health department. We're happy to accommodate in any way that we can. And we have the adult mental health first aid, which is a great 1-day course. Coaches, teachers, if you work with children and their youth in any way, this is a great course to take to be able to learn how to see signs of mental health concerns or issues. And that's on September 24th here at the town hall. And our office, along with community wellness, teaches that class.
Still available for people to sign up for?
There are some spots available. And again, you can call the health department. We'd be happy to help you. I think that is everything.
That's great, Ray. Thank you. Thank you all for everything you guys are doing, and especially during these tumultuous times for public health.
Thank you.
Would anyone like to make a motion to adjourn?
I'll make that motion.
Okay, motion made. Is there a second?
I'll second.
Motion made and seconded. All in favor, Stephanie, aye, Michelle,
Aye.
Joanne,
Aye.
Megan,
Aye.
and Stefan.
Aye.
Great, thank you. Have a healthy week.
Thank you. Have a great night.
Take care.